Well, this is a topic that was very difficult for me to compress. It's very difficult for me to compress this because it's an enormous topic. The depletion of our own health or sustainability of our own health. But it's worthy of another lecture or two or three. I call it, why do we do it? The reason I call it why we do it is because today there are so many highly respected organizations that have had to make position statements about this based on all the exhaustive amount, the immense amount of literature, documented publications, books, case studies, all supporting literature found related to the topic that eating a plant-based diet is healthy versus eating an animal-based diet, which is not healthy. In fact, I can sum this up by just letting you know about one of the most recent publications by T. Colin Campbell, where it's called the China study. I don't know if any of you have heard of that. But basically, about 750 other researchers independent of this study found exactly the same results. And what he did was, he took thousands and thousands of examples and case studies in China and the Philippines, and demonstrated very clearly, without a doubt, that the 4 leading causes of death in the US today, which are coronary heart disease, malignancies or cancer, cerebrovascular disease or stroke, and diabetes. All 4 of those have animal protein as implicated as the highest risk factor from our diet. And so let's just look at some of the organizations. I mean, there are hundreds of organizations now, very influential organizations, that all had to make position statements related to this. Choosing just one of them, the American Dietetic Association. This is a summary of an 8-page report stating that essentially a plant-based diet will reduce your risk of these chronic diseases. They could have added to this list kidney stones, gallstones, kidney disease, diverticulosis, osteoporosis, which is becoming a very large problem in our country. They could have added to it Alzheimer's disease and dementia. In fact, it needs to be clearly understood, at least by everybody in this room, but certainly I think by everybody in the world, that the link today between eating animal products and many of these different types of diseases that we're all suffering from is as strongly supported by our scientific literature and case studies as the link between cigarette smoking and lung cancer. Taking just the statement of the American Cancer Society, they went a step further and gave percentages, showing that the people who did not eat, individuals who didn't eat animal products, had 50 to 70% less likelihood of developing many cancers. At the high end are processed meats, and otherwise, all of these things that we're talking about, development of Western-type diseases, chronic diseases, all the types of cancers we're talking about, are related principally to the risk factor of animal products. Eating meat is also implicated in esophageal cancer and liver cancer. And I want to emphasize right now that in Dr. Campbell's findings, he found, in terms of cancer, the 5 leading causes of cancer that we have in the world today, which are lung, colon, breast, pancreatic, and prostate. All of them, all 5 of them, have animal protein as an implicated high-risk factor. In fact, it needs to be pointed out that most of his studies were done in rural China and Philippines, where all the cattle were grass-fed. Why? Well, because eating plant-based diet reduced your risk of this. They have phytonutrients, they have different constituents in plants that aren't found in animal products. They reduce your risk of developing cancer. And on the other hand, there are many things found implants that cause cancer. Heterocyclic amines, polycyclic, aromatic hydrocarbons, things like that. Things that cause cancer that are not found in plants. Well, this is an astounding figure to me. In fact, this is the low end. It's estimated between 140 and $300 billion each year are spent on healthcare costs due to eating livestock, not due to eating agriculture, or we're going to mix up our words here, is due to eating animal products. And the thing that I find most astounding about this is all the energy, money, and time that's being devoted by our government right now today to try to find solutions to our healthcare problems. Why are things costing so much? What about the insurances? Who's going to pay for all this? And yet they have no program whatsoever to recognize or to implement in dealing with one of the largest components of it,